Hey, hello, good evening, and how are you? Happy new month, happy Sunday. Welcome to the month of March 2026. How are you doing now? My name is Dr. Frederick Unigbohai, and I'm the host of this program, Ask the Doctors. The program holds every Sunday by 8 p.m. to 9 p.m. How are you? Where are you watching me from? Can you hear me? If you can hear me, I want you to tell me where you're watching me from. Let's see. Okay, good. Okay, good, good, good. Yes, the sound is great. So, how far now? Tell me, where are you watching me from? Yes, I need to know if you can see me and you can hear me. Today's program, we'll be talking about hemorrhoid. We're talking about hemorrhoid, meaning that if you ask us any question that is not related to hemorrhoid, nobody will answer you. We no go respond to you. But if you have any questions concerning hemorrhoid and you ask me, sure banker, we go try, we go answer you. But right now, I want you to tell me if you dey hear me first of all. Oh yeah, let's go. I dey live on YouTube. I'm live on YouTube. I'm live on Facebook. Yes. Oh yeah, talk to me. If you know that you can hear me, I want you to tell me. I dey hear you. I dey see you. I dey hear you. Let's go now. Oh yeah, now talk to me now. Um, I need to see your comments. Yes, I have somebody here watching from Cross River. Reach desktop. Can reach desktop. How far? How are you? Today we are talking about hemorrhoid. We'll be talking about hemorrhoid. People have been talking to me. They want to ask questions about this topic. I made a video some time ago, and I said, okay, let's discuss hemorrhoid today. Uh-huh. Now, if you have any questions on this topic, just take them down, and soon I will come to you. But first of all, have you heard about hemorrhoid before? Hello, hello, sir. I'm talking to you. And if they follow you talk, have you heard about hemorrhoid before? Yes. Oh yeah, tell me, what you understand by hemorrhoid? Oh yeah, now, what you know, say be hemorrhoid. No, no lie, oh. Follow me talk now. Follow me talk. Yeah. I'm doing well. Okay, great. You don't hear about hemorrhoid before. Now, let me start on this note. Sugar. A lot of people go tell you, say, sugar, they cause hemorrhoid. My guy, sugar, no, they cause hemorrhoid. Because this one very important information, sugar, no, they cause hemorrhoid. So, what is hemorrhoid? What is the hemorrhoid? Who know the answer? Oh yeah, tell me quickly. Who know the answer? Oh, I wait for you. Um, let's see. Hemorrhoid, Hemorrhoid na enlargement of the structures. Make I use structures around your inner region, your anus, your nyash, inside where shit stay they come out. It gets structures where they there, some kind of things where they there, where they help you so that poo poo no go they leak come out from your anus. Those things are normal there. If those things can't they enlarge, they can't swell up. Those things enlarge, swell up. We talk say the person don't get hemorrhoid. So no be say somebody he chop sugar, now he can get hemorrhoid. Hey, chief. Good evening, sir. Long time. How you there now? It's been a while. Happy new month. So now hemorrhoid be that. When you have those your normal structures, your anal cushions, when they become enlarged and displaced, we go talk say the person don't develop hemorrhoid, and they are very common. A lot of people get hemorrhoid, and they don't want to tell anybody. Some of them think say they get hemorrhoid, but now something else they get, they don't know. They go sit down for house. By the time the thing don't waka, cause problem for their body, at that time they will come the wrong come hospital. By that time, God forbid, if you don't cause a lot of problems. So now the thing, the hemorrhoid be that. Hemorrhoid can affect man, and hemorrhoid can do it in hemorrhoid can affect woman. Hmm? It affect man, it affect woman. And it get a lot of things where they cause hemorrhoid. Many things they where people they do where they cause hemorrhoid. But it's important I make you understand that not be everything will happen for your anus be hemorrhoid. No be everything will do you for your nyash be hemorrhoid. It's important. When you have a medical problem for your body, it's important you go to the hospital and see a doctor. Not be say you go carry your nyash, go somewhere, say me then check for you. No, hospital. Because you might think you have hemorrhoid, whereas not be hemorrhoid you get. Now something else they do you. You they follow me, Abi? Hello. Oh, now for those who just they come, this program we've been having this program for the past 6 years, every Sunday. Now we the day here, and I beg we know they give number, we know they private chat anybody. If you get any medical problem, any medical condition, you go hospital, you go see your doctor, may then check you, may then treat you. So now we have different types of hemorrhoid. I see questions. Don't worry. We go take your questions. We get different types of hemorrhoid. I want to make you understand. We get different types of hemorrhoid. We get the hemorrhoid where they inside the nyash, inside the anus. You know they come outside. They're not the siam. You know the siam. So even if person tell you say you get hemorrhoid, you don't go know because you are not a doctor. So we get the one where they inside. Hemorrhoid where they outside. Dr. Israel is in the house. We get the hemorrhoid where they inside the person anal canal. We get the hemorrhoid where they external, where they outside. Now that one you they see say it come out. Let me bring up Dr. Israel. Dr. Israel, good evening. How you doing?
Good evening. Happy Sunday.
Yeah, happy Sunday to you. How your side now?
Well, we thank God. We thank God.
Nah, so I greet
And
you.
also, Happy New Month.
Yeah, happy new month. Now, we they talk about hemorrhoids. I beg, if you ask us any question, we know they related to this topic, we not go respond to you. We not go read your question. Good. So before Dr. Israel came, I told you what's in the hemorrhoid. I explained to you, and then I tell you, say, no be sugar they cause hemorrhoid because I hear a lot of people will talk, say, doctor, if you take sugar, you go get hemorrhoid. No be sugar they cause hemorrhoid. And I went further to tell you that hemorrhoid get two types. The one with the inside, they come out internal, and the one where they come outside, external. That one you they see them. But the one where they inside, now the one where they see. So may I just allow Dr. Israel, may just put one or two, and then we go move very fast. Dr. Israel, back to you,
Okay. Hemorrhoid nine. They call pie. When we all know, and then they call pie. As Dr. Fred talk, sugar not be sugar they cause them. Now swelling of the veins. When they the inner region, when they that region. And when the vein does swell, now what they call hemorrhoid. Now you should also know say one of the it just be like people will get varicose vein for their leg. When we say varicose vein, those vein, you see some people, you see like some kind of vein for their leg where be like spider web, where you big, swear. Eh? If it happen for the anus, now would they call hemorrhoid, now would they call pie. So as Dr. Fred talk, there are two types, and he don't already tell us the two type, and he don't also explain how the two type be. So hemorrhoid, they common in some way. Many people get them, but sometimes because the two cause problem, most people they overlook them. So they sometimes it may just be there, not they give you problem. So you're not gonna need to do too many things. But once they start to they give you problem, then you need to actually address the hemorrhoid. And also e good for you to know say pressures and stress, strain, um join the things wey dey make hemorrhoid dey quick happen. Dr. Fred.
Yeah. Thank you very much, Dr. Israel, for this one where you try explain. So when we move quickly, talk about those things where they make people get hemorrhoid because it plenty. Waiting be the things if you make a man or a woman develop hemorrhoid. The first one, now when the pressure for your belly, when you don't plenty, you don't strong pressure, so that you dey for toilets and you dey use force to shit. So we go talk say somebody will get constipation, where they find them difficult to shit, to kaka, you go for toilets and you go sit down for there, your poo poo no go come out. You go dey strain, you go dey This the poo poo they very strong. As you dey use force, you dey use force, you dey use force. Small, small, those structures around your inner region, you dey weaken them, they go pull out. So um, we call chronic constipation. Now one thing where they make somebody develop hemorrhoid. Another one, now the person diet, the kind food where they chop, your food, they take water. That one they make your poo poo strong. They chop fiber. Fiber no dey your food. And those fiber they important for the things wey go make your poo poo dey okay to pass. So when they chop fiber, when they take water, all these things go make your shit strong like stone. And you go dey for toilet, you go dey strain, dey strain. Final one where I want talk, and then I go hand over to Dr. Israel again. Make we still talk about some things where they cause hemorrhoid. Now, a bad habit where a lot of us they do. This bad habit be say you go sit down for toilet for 1 hour. You go sit down for there because that place they quiet. You go dey press your phone. These habits over time, you go dey weaken those structures where they around your inner region. So as you dey press your phone every day, they sit down for toilets. That space of your anus go dey pull small small, go dey pull small small. These are some of the things we fit add to hemorrhoid. Make I allow Dr. Israel over again, then we go to the next one. Dr. Israel, over to you.
Okay. So other things wey fit still be like risk factors wey fit make person quick get hemorrhoid. We should know say one thing you should know is about when there's a strain in that region, weakness, anything wey fit cause weakness for that the anal region go actually makes people get hemorrhoid. So even pregnancy for women, pregnancy na one of the things wey fit make people get hemorrhoid. Mostly when it comes reach time for labor, when they try to push out their baby, that can actually lead to hemorrhoid for for some for some women. Chronic diarrhea, person when they purge. When you go toilet for sometimes for chronic diarrhea, your think say stool kaka dey inside there and you dey push yourself, they strain. Yeah. So chronic diarrhea still join wetin fit make person get hemorrhoid. Dr. Fred already talk say people wey no dey eat food wey contain fiber. When we talk about fiber, we dey talk about food, vegetables, orange. When you look orange, that inside, all those kind of roughages, yes. People wey no dey too eat those things, they also dey quick come down with with hemorrhoid. So those people wey see dey lift weight, regular weight lifting, every time you dey go lift weight, you go do exercise, it's fine. But every time you dey lift weight, they lift weight. So that kind of person fit still come down with hemorrhoid. Those wey dey knack for wey dey practice anal knacking, wey dey na the anal side, the yan yes, the anus na dem dey knack. um all those one fit still come down with hemorrhoid. Now, when we talk about sitting down for a long time, Dr. Fred talk about sitting in the toilet for a long time. But that na one. So we still dey talk say when you even sit down, when you dey do work wey be say you dey sit down for a very long time, e fit still contribute to making the muscles and every tissue and in that the anal region weak to the extent say person fit come really get hemorrhoid. So we dey encourage or we dey advise say sometimes when you sit down, um even for work, after some time e good make you stand up, take a little walk, then come back to sit down. That's why we say, oh, those sitting down for toilet just dey spend the whole day there. And one risk factor wey dey common is age. As people grow old, na most things dey happen for their body, and one of the things na be say all those muscles all wey dey that region, wey dey their inner region go dey weak, and because dem dey weak, dem fit still lead to this hemorrhoid. Yeah, so dem fit still lead to this hemorrhoid. So the Dr. Fred don already talk about the kind of food wey you dey eat. You no dey drink enough water, so it simply mean that we need enough water. I think these are some of the causes or risk factors for hemorrhoid. Dr. Fred.
Yeah, thank you so much for this one, Dr. Israel. If you just come this evening, we did talk about hemorrhoid tonight. We did try break them down so that you go understand. And if you get any questions for us for this topic, I beg, take note of them so that we go fit respond to you as we continue this evening. So now I've been put something for the screen. We talked on before. Make I just show you here. If you look your screen very well, you go see say we get two types of hemorrhoid. The one where they inside, internal, and the one where they come out, external hemorrhoid. And these hemorrhoids, they're very important because for some individuals, for some people, not only this internal hemorrhoid then get internal. You see them inside, come out. Some individuals get external. This one, it come out for their caca area, the anus. Get some people, they have the both of them. They have this internal, they have this external hemorrhoid. Now, the way the thing go do the person is different. If na internal hemorrhoid or external hemorrhoid. So somebody go tell you, say, I go toilets. As I dey caca, I dey see blood. Internal hemorrhoid, they give that one. This is trying to make you understand about the symptoms of hemorrhoid. Internal hemorrhoid, they are among the things where they cause that one. Some go tell you, say they see mucus for their anus, like kata, all those things. They come out. Internal hemorrhoid, feel give you that one. When the person go toilets, it can't clean. It clean a anus. If you see blood for the tissue paper, we'll be like, waiting they happen now. What is going on? These are some of the things where the person go see. And then sometimes that area too, if they scratch the person, if they scratch them, these are some of the things where the person if see. Then when you can't go into the one where get external hemorrhoid, the person if they get pain. Person if tell you say, bless something they come up for my anus, something they heavy me for my caca area. If he gets that one, so if he gets swelling, something come out. If he they pain him to sit down, if they go they hard this person, and then person if they get discharge for that area of the anus. If you never share this live session, so that more people go come watch us. If you never share, I need you to share the live session so that those where they follow you go see this video and they go join us. Dr. Israel network don't spoil. I don't know what's spoiling network, but I go try bring them back when it comes. Now, if you understand the thing where I talk, I beg put some for the comment section so that I know that you they follow me, you don't understand. Oh yeah. Put in the comment section. Let me know, say you they follow me. I don't put the picture of hemorrhoid for the screen. You see person feel also they see some kind of symptoms. Yeah, Dr. Israel is back. Let me bring Dr. Israel up to the screen now. Yeah, Dr. Israel, you're welcome back. You're welcome. So I don't know if you want to add anything to
Thank
the
you.
symptoms so that, yeah, I don't know if you want to add anything to the symptoms, then we can now continue.
Okay, I don't know what you mentioned, but maybe if I mention anyone, it may almost be same. But we just know say the symptoms is based on the type. Yeah, the type also they make us know the symptoms. So if the internal hemorrhoid get your own type of symptom, if the external hemorrhoid it get your own type of symptoms. One thing you should know for external hemorrhoid is that one of their symptoms are inching. The place go they inch you. Yeah, sometimes pain fit come even enter and some kind of discomfort because e dey outside. While for the internal hemorrhage, most of the time e can be bleeding and it's painless. So person go dey toilet as e kaka, you see bright red blood stain the body of the toilet. Or sometimes when you wan even clean your after you don kaka, when you wan clean yourself, you notice am. So these are not just some of them. I know say Dr. Fred we don't talk many, you don't tell us others. So that's why I don't want to repeat what you don't first talk. So I think it's just for you to know say it's divided into two. We have the external and the internal, and they all get their own symptoms. And the major symptoms when they between two of them and that bleeding. So the external one you can see bleeding, the internal one you can see bleeding uh, as well. Dr. Fred.
Yeah, thank you very much, Dr. Israel. So just to make you understand, as Dr. Israel mentioned before, the person feel also get itching. If they scratch the person feel see blood, the person feel get discharge and many things. Now, as we continue, if you get questions, start to drop the questions in the comment section, so that make we try see whether we feel respond to you. But if you never share this live session, if you never share, and you can't dey ask us question, we go see your name, say you no share. To answer you go come hard though. So try to share this live session so that make people come watch right now. Now, e get one important thing where I want to talk, then I go hand over to Dr. Israel. How we take the know, say this one a hemorrhoid or not. But I won't beg you. E get some other medical conditions where somebody could get. If the person gets these things, they share, our people are not sharing. I just confirm. If the person gets these things, you go think say na hemorrhoid you get, whereas now something else dey the person body. Why am I saying this? I'm saying this so that you no go try sit down for your house. They try to diagnose or try to diagnose somebody else. Say this person na hemorrhoid they do, there are other medical conditions where the person go get. The person fit still see blood for the inner region. The person fit get pain for that inner region. The person fit even get swelling around that region. The most important thing you need to do be say, if you notice these symptoms for your body, make sure you go hospital. No go sit down. They try to make diagnosis, and then your problem will come spread, give you serious issue. By the time you come hospital, water don't pass Gary. You dey follow me, Abi? So let's talk waiting somebody go do. If the person notice all these symptoms we will mention, what will now be the next line of action for this fellow? Dr. Israel, over to you.
Okay, for somebody when notice say man, let's say you don't dey say all this, you don't dey notice all these symptoms when they talk.
I can't hear Dr. Israel. I can't hear. So I will bring him back when he comes up. Now, this comment is important. Very important. Not go they ask people for social media or be online. Thank you very much. A lot of people go suffer. This is not prophecy. This is not curse. Instead of them to enter hospital and see their doctors, they go online. I beg go. if this thing they do you, wetin e mean, wetin e be. Different people go come, they tell you different things. Now so you do my neighbor. My neighbor go put hot water for inside in anus. Oh, now so you do my landlord pikin. Oh, he use firewood put for there. Oh, you don't do my grandpapa, mama, sister pikin. Everybody go, they give you different opinion. By the time you collect all of them finish, you don't use your own hands, scatter your what? Scatter your inner region. So make sure you go to the hospital and not looking for treatment from people on the internet, not even on this live session. Go to the hospital. Now, if you can't notice all these things for your inner region, you go hospital. Doctor go follow you talk, eh? He go ask you plenty things. When it starts, how many years you be, which kind of work you they do. You don't do best for your family before. They pain you, blood they come outside, they scratch you, your belly swell up, you they lose weight, you they feature up, your body they hot, you they sweat, plenty things. You vomit, you they purge. How many times you they go caca? How many times you they poo poo? When you go toilet, how many hours you they sit down for toilets? Your poo poo strong, blood dey your poo poo. Many things dey where your doctor go ask you. Oh, Dr. Israel is back. Dr. Israel, you're back, right? Do you hear me?
Yeah, I think so.
Okay, good. So I was talking about wetin person go do when he notice this thing as he go hospital. So make I hand over to you. May you continue.
Yeah. So you need to go hospital, and when you reach hospital, the doctor will ask you a lot of questions. Those questions I go make the doctor know what he really they do you, whether you really get hemorrhoid or whether not something else. Now they cause the problem. So when you get this symptom, I better not sit down for hours. It is good you go to the hospital so that may they know the line of treatment management when they'll give to you. Also sometimes when you go hospital self, they may never tell you to buy medication or do so or any procedure for you. If you be say you just need to do some home remedy, when you do all those home remedy, they can actually help you. And these are also ways to prevent hemorrhoid in the future. Part of it now to eat high fiber food will contain a lot of fibers. Yeah, there is food like vegetables, food like fruits. So you need to take more of those things. And apart from that, it's good to drink a plenty of fluid. Yeah, when we say plenty of fluid, it may not be only water, but water is the best. But every other thing that can serve as water. Yeah. So taking plenty of fluid, let's just say water, that and say another thing. When go fit say help you. Now, because you don't strain. When you dey toilet, no go dey press yourself. No, not press yourself. Just relax. And the ones wey go come out, go come out. Yeah, so when they come out and you know that you are okay, you come out, you leave there. Then we'll see say make you avoid sitting for a long time. Whether na for toilet or you want go to sit down, they watch press your phone, or whether na for your workplace or wherever you dey sit down for a long time. You just need to avoid for a long period of sitting. So it means say if you sit down for some hours or for some time, it's very good, very important that you stand up and stretch your legs more. And you just walk around to also help yourself. That exercise is also important. Yeah, because when you do exercise will also help to prevent constipation. Because we know say constipation are one of the cause of hemorrhoid. So one of the risk factors. So when you do good exercise, it will also help. You know, mean say you go they carry weight, they carry no. Even though you want to carry weight, it's not a compulsory thing that you must carry it every day that you go for exercise. So when you notice all those symptoms, as I said, hospital now be the first place to go. However, after you don't go hospital, the doctors will tell you all these things. When I tell you, the doctors will still tell you. But if you never they notice them, if you they do all these things, most of them, if you they do one, it will actually protect you from coming down with hemorrhoid. Yeah, Dr. Fred.
Yes, so thank you very much, Dr. Israel, for this one. The people where they ask us questions about hemorrhoid, If you want ask now, ask ask. What will they do for me at the hospital? The type of treatment where your doctor will give you now based on the kind of hemorrhoid where you get. No be every hemorrhoid that they operate. Yes, say if you get pile, they go operate you now operation. No, it's not true. Not be everybody that they operate because your doctor, your general surgeon go look you, go say, no, we don't need to operate you. They will tell you. For some other people, they go tell them say, like how Dr. Israel talk, change your diet, do this and do that. For some other individuals, if you come tell them say, okay, we go operate you. Now so they do am. But I hear say if they operate the person go come by and the person no go there alive again. No, it's not true, sir. It's not true. You know they buy. They're not they buy. They have different modalities for procedures around that area. So if you get hemorrhoid, the best thing for you to do now for you to do it to speak with your doctor. Okay, see I'm now. Dr. Israel, I beg. May we respond to this comment. Is it advisable for one to do surgery for pile? I beg, help us respond.
Yeah, you just answer and just now. So one of the modality for treatment is surgery. Yeah. Even at that, there are different type of surgery when they go do. So and it also depends on waiting the doctor see when you present yourself. So when they tell you say yes, now surgery thing, mostly when the people don't they get uh, fibroid, when don't they cause problem like
Say
strangulated, I say
fibroid.
fibroid, sorry, hemorrhoid, sorry. What I go see for fibroid? Hemorrhoid, like somebody don't they get strangulated hemorrhoid when we say it protrude, come out, it not go inside again, can they cause serious pain and infection can they enter. In fact, problem all day there. That kind of one, they will tell you say surgery, and is the best solution they can as at that time for you. So if they have tell you say do surgery, nothing can 2 times, nothing say waiting go happen, nothing go happen to you. Nothing go happen to you, you'll be fine. But the only thing is that make sure say you are the right place. When I mean the right place, you are in the right hospital, so that when they do the surgery, you go there all right. Dr. Fred.
Yeah, thank you very much. Okay, we don't answer the question. Now, I beg go. Like we mentioned before, it's important that you follow the advice given to you by your doctor. What can you now do to prevent hemorrhoid? Make hemorrhoid no visit your domot. What can you do to avoid hemorrhoid? This is very, very simple. Now, number one, they say, like if you listen to from the beginning, the kind things where you they do with your feeding, take water, drink water, take fiber, vegetables, fruits. They are very good. They go help you. When you enter toilets, make sure say your caca no dey strong, may no hard, because the more your poo hard, the more you go dey strain. The more you dey strain, the more you dey weaken those structures around your inner region. Small, small, you can develop hemorrhoid. Not dey sit down for too long. Get up, move around. Make sure say you dey mobile, you dey active, your body dey active. And then even for those where they obese, you go good, make you try to control your body weight. This is very, very, very important. I don't know what another thing they again where I don't miss. But maybe Dr. Israel will add one or two on top of that. So this one will help you try. Now you get one type of hemorrhoid, where be like genetic. Hemorrhoid can also be genetic, meaning say when somebody for the family get them, the person for the family fit also get them. Like a father has hemorrhoid, there's a chance that the son can also have can have hemorrhoid. So you, if you know say somebody for your family get this kind of thing, you have to deliberately, consciously make sure say you try your best to avoid them. Make it no come meet you. Dr. Israel, You get any other thing to add again?
No, no, on that matter, no.
Okay, very, very important. Um, like we said about the hemorrhoid. Now, one very common condition if you look like hemorrhoid. Now, what we they call colorectal cancer. Some people go get this cancer. The only sign where they go get now bleeding. And remember, person if you get hemorrhoid and the person if they see blood, the person go sit down for house, go they see blood, go they bleed, he no go hospital. By the time this fellow go present to the hospital, the cancer don't go far. So it's important you take note of this. You don't look at every bleeding and say, oh, I listened to that video online where they spoke about hemorrhoid. If you get bleeding, now pie they do you. No be pie. Go to the hospital and see your doctor. Is that okay? You get questions,
Yeah.
ask me now. No ask me for private chats. I no go give you private chat. So we no go give you number. Hey, doctor, good evening. Please, can rubber band treatment permanently cure pile? This is from Worry. Dr. Israel, beg, help us.
Okay, we said there are different modalities for the management of pie. So I really don't know this rubber band management. However, I know suggest there something they can use to tie it. After some while, you can either go inside or remove. So whatever one, as I said, whatever one that your doctor decides is the best as at that time, and that's what they will do. And whatever they do, it will actually protect you for a very long time, and it can also cure it. Even when you do the surgery, do all those other form of management, you still need to look at the preventions. You still need to eat fiber, good food that contain fiber. You still need to reduce straining. Yeah, because if you not reduce the straining, you not eat food that contain fiber. Most of the time, it may reoccur. If it not be the one way if it happen, if it be another one, like on the show himself. So because of that reason, it go make sense. As so, it go make sense. Make as you the manager, as they treat am for you, you go still dey look the prevention aspect. Now, before we answer any other person, we will just look complications. So hemorrhoid still get im own complications. Don't be say because e not too, for some people not too serious, they just say e just be like that. Remember, we say sometimes this person fit dey see blood when they come out if e go toilet. Now, this bleeding, if e don dey for a very long time, e fit lead to anemia. When we say wetin be anemia, person wey no get blood for, wey e don dey short of blood for body, na im be anemia. So some people fit come down with anemia. Well, these are dey a bit rare, but it can happen. Then another one, remember, say this hemorrhoid sometimes dey protrude come out, you come outside from where e dey. If you not take care of am, there's what we call strangulated hemorrhoid. It means that the hemorrhoid come out, it won't go back, it not fit go back. So it will come tie for there, and pain will come begin from there. And then the last one, what they call blood clot, because they spill blood. Sometimes this blood can actually gather and form what we call the hemorrhoid. Yes, it can actually gather at different points. And so that are some of the complications when person with hemorrhoid fit get, Dr. Fred.
Okay. Thank you, Dr. Israel, for this. Now, for you, where they watch this video for the first time, this program holds every Sunday by 8 p.m. to 9 p.m. We did here for the past 6 years. We did here. Today, now hemorrhoid, we did talk about. Now, the questions we did about hemorrhoid, we did attend to. If you get any problem, any sickness, any matter, go hospital. We no go answer you to they give you treatment here. We know they do private chat with anybody. We know they do that one. You go hospital. If you insist, say you won't follow anybody for here talk, you go book for consultation because we don't get time today follow everybody chat. You understand? But we go advise you, make you go hospital. And today's program now about hemorrhoids, and we don't talk about what they cause hemorrhoid, what the person go see, what be the symptoms. We tell you say hemorrhoid fear affect men, fear affect women, they affect people all over the world. We don't tell you say if person get hemorrhoid though, may you go hospital. Not be say you go they ask in neighbors, go hospital. But I hear that when you go to hospital, the doctors will not take you serious. Now social media be the hospital for you. No hospital. Then they go come tell you this and this and this and this is what you will do, depending on the type of hemorrhoid. Because we told you that there are different types of hemorrhoid. If you like your nyash, no sit down for social media, they look for treatment from people where you don't know. Take your nyash to the hospital and let a medical professional attend to you and your nyash. And then we spoke about the prevention. We spoke about the complication. This is extremely important so that you no go suffer from hemorrhoid tomorrow. It clear, abi e not clear? Dr. Israel, you get anything you want to add as we prepare to round up tonight?
Okay, I noticed many people not ask question today. It simply means say they understand them very well, or maybe most people not just want no one ask question because of the kind of topic. But it makes sense say make we dey ask questions. And also makes sense say make we know say once you get any complaint, any complaint, try enter hospital, because that place you will actually get the best. And even when we dey say enter hospital, we not say make you go find quack enter. We dey tell you say make you enter hospital that have good reputation, hospital wey dey very very good. Now pie or hemorrhoid as we call am, some people dey even dey think say they need to take whatever they like to take cure the pie, because they don hear for so many places. This one say bring, I'll give you this concussion, this one say this concussion, and some of them after they don take am for a while, nothing dey happen. So e good for us to know say we need to protect ourselves. Don't go overtake wetin you don't need. Make your liver, or yes, make your liver and your kidney not gonna go suffer am in future. So whatever you do, go hospital, let your doctor be the one to tell you what kind of treatment you need. And when you get the treatment, I believe you will be fine. Dr. Fred.
Yeah, thank you so much, Dr. Israel, for your time. Thank you for watching. We don't do the best we can. We don't explain to you. If you carry your nyash, go where you don't know, then destroy your nyash. And nobody say you go come back online, come they cry, they beg us. No, no, no. It means say you know listen, you know follow all the advice we give to you. Carry that nyash and see doctor. May then check you. Next Sunday we go day here by the grace of God, and we go attend to you. We never know the topic. Maybe we will do open day. Maybe we don't know yet, or we will do a particular topic. But not forget, not joke with your health. Like I always tell you, good life now waiting. Good life now says. Pastor Israel, thank you so much. Thank you so much. Take care of yourself and have a wonderful day. Bye bye.